answers so that we can, get things going. So the first question is this. You have a 34-year-old man. And every question, I'll just give you 15 seconds to answer. A 34-year-old man presents with fever, sore throat, and maculopapular rash on his trunk and his face. He reports a recent unprotected sexual encounter. His rapid HIV antibody test is negative. Question: which of the following is the most appropriate next step in the diagnosis of this patient's condition? A. Repeat the rapid HIV antibody test in 1 month. B. Order an HIV RNA PCR test. C. Perform a heterophil antibody test. And D. Prescribe empirical antibiotics for suspected bacterial infection. So doctors, you have 15 seconds. Just get into it right away. Are you going to go for A, for B, for C, or for D? Type your answer. I see a lot of people, typing B. Dr. Khadija too is typing B. Dr. Sabine is typing B. Dr. Freddy is also typing B. So what is the right answer? The right answer is B. So all those who wrote B, there we go. So which of the following is the most appropriate next step? Remember that this person has had unprotected intercourse. Now the person has fever, sore throat, maculopapular rash on his trunk and on his face. You realize that these symptoms, and as I said, today I'm not going to do the typical notes thing. Today we are going to use questions, and by the time we are done, you'd have covered HIV top to down. Okay. Now, if you see the person's presentation, fever, sore throat, maculopapular rash, these are symptoms of acute HIV infection. Okay. And when you are suspecting that somebody has acute HIV infection, what is the lab investigation you need to do? You've got to order an HIV RNA PCR test. Okay. Now, why are the rest of the answers wrong? Repeating the antibody test later could delay the diagnosis. So that is why A is wrong. And heterophil antibody test is not used to test for HIV. Rather, it is used to test for infectious mononucleosis. So you realize that in as much as we are doing HIV, I'm also bringing in other concepts. So how do you diagnose infectious mononucleosis? You use heterophil antibody tests. And why is D wrong? D is wrong because you've not confirmed that this patient has acute bacterial infection. So with all the answers we have there, the correct answer is B. So all those who got B correct, that's great. Okay, we're going to go to the next one. And I'm going to read a question for you. I'm just grabbing a piece of paper so that I can also, solve the questions with you. So a 29-year-old woman presents with a 3-week history of fever, lymphadenopathy, sore throat, and diarrhea. She has had unprotected sex with a new partner. Physical examination reveals generalized rash and mild hepatosplenomegaly. What's the most likely diagnosis? A. Acute HIV infection. B. Epstein-Barr virus infection. C. Cytomegalovirus infection. D. Acute hepatitis B infection. What answer will you go for? Will you go for A? Will you want to go for B? Will you want to go for C? Or you go for D? What answer will you go for, doctors? Dr. Mana Ekweme says he'll go for A, acute HIV infection. Dr. Freddy also says he'll go for A, acute HIV infection. Dr. Kemi also says she'll go for A. Beautiful. There's constellation of symptoms. So what I'm using this to repeat the concept of acute HIV. Fever, sore throat, rash, lymphadenopathy. Okay, in the context of unprotected sex with a new partner. So those are the features, right? Now, the issue is that Epstein-Barr virus and cytomegalovirus can also present with similar symptoms. However, they are less likely to cause generalized rash and hepatosplenomegaly. So why did we go for HIV, even though Epstein-Barr virus and cytomegalovirus can also present with, sore throat and fever, because those two conditions typically do not present with generalized rash and hepatosplenomegaly. In patients with acute hepatitis B infection, usually in a board exam situation, you are looking for the presentation of jaundice, but jaundice is not presented here. So doctors, we are learning how to use clues to pick up our answers. Okay, next question. And doctors, if you have any question, please don't hesitate to put the question in the comment section, okay? Because many of us think that these concepts, oh, HIV, I know HIV, oh, I know HIV, I can kill HIV in the board exam. But today you see the kind of things we are learning. So you have a 28-year-old male who presents with fever, headache, photophobia, neck stiffness. He reports recent unprotected sexual encounters. So it looks like this patient has had encounters with many patients or many people. Lumbar puncture reveals lymphocytic pleocytosis. His HIV RNA PCR test is positive. Which condition is most likely responsible for his symptoms? High-risk sexual behavior, neck stiffness, photophobia, headache, fever. But the lumbar puncture reveals lymphocytic pleocytosis. And HIV RNA PCR test is positive. Which condition are you thinking about? Are you thinking about bacterial meningitis? Are you thinking about viral meningitis? Are you thinking about aseptic meningitis due to acute HIV infection? Or are you thinking about tuberculous meningitis? And I can see that a lot of people, some people are going for B, some people are also going for A. What is the right answer? The right answer is C. C. Why? Aseptic meningitis is a recognized complication of acute HIV infection. And what is one key characteristic of aseptic meningitis? The patient will present with lymphocytic pleocytosis. Now, how do you differentiate the kind of aseptic meningitis from bacterial meningitis? You realize that with bacterial meningitis, the patient will show neutrophilic pleocytosis, not lymphocytic pleocytosis. The patient in bacterial meningitis will present with neutrophilic pleocytosis. So now, bacterial meningitis will likely show a neutrophilic pleocytosis, while tuberculous meningitis would have a different presentation and epidemiological context, because the patient might be presented as somebody who has had chronic cough, or maybe the patient might have been in prison, or the patient might have stayed in a crowded environment, or the patient might not have had, tuberculosis vaccination, or the patient might be a new immigrant to Canada. Right? So what are some of the key things that you can use to pick up tuberculous meningitis? Those are some of the clues I've just mentioned. Living in a crowded area, prisoner, recent immigrant to Canada, somebody who has not had, tuberculosis vaccination. Okay, good. Viral meningitis is a broader category, and it includes aseptic meningitis due to HIV. So that's the beautiful thing there. So I was even going ahead of myself. What are the key features, or what are the key differences between lumbar puncture findings in a patient with bacterial meningitis, in a patient with viral meningitis, and in a patient who also has tuberculous meningitis? Please, doctors, I want to see that assignment tonight before you sleep. All right? What I want you to do is to differentiate the cell type from the glucose levels and the protein levels. In which of them do the protein levels go high? In which of them are the protein levels normal? In which of them do glucose levels change? I want to know. Just let me know what you learn so far as this thing is concerned.